Hello, this is Dr. Ely. Welcome to ReadyRNs. We're going to take a peek at medication mastery here, get to know what it is and how to use it. So let's begin. So here you can bring up any medication you want. Any class, you want to learn about medications for sepsis or diabetes medications, chemo medications, doesn't matter what it is. We can put it in here. For example, let's just say chemo medications. And it goes through a specific process. It will give an introduction to the thing you're inquiring about, the type of medication, and then it will go on to give more in-depth detail about what nurses need to be concerned about, followed by quizzes, 5-question quiz, and then lastly, it'll end with 2 scenarios that these type of medications. So now we can see chemo medications. I'm not a chemo nurse. I've actually worked in ICU, and so this is all new for me. Chemotherapy medications play a vital role in treating various types of cancer, so you can see the type of class of medications, specific examples of medications, the description of what they do, and the clinical uses. And then it says, would you like to do a dive deeper in specific chemotherapy medication or class mentioned in the table? If so, let me know which one. Otherwise, I can start providing detailed information on the specific medication you choose. So let's do this one right here. So I'm just going to copy and paste there. Perfect. So now you can see that it's giving more detailed information: mechanism of action, pharmacokinetics, therapeutic uses, dosage and administration, monitoring, contraindications, precautions, adverse effects, special considerations, drug interactions, mechanism, and so on. It looks like it's doing it for both methotrexate and 5-fluorouracil. So that's why you see these doubled, is because it's actually looking at both the medications I mentioned before. It says, would you like to proceed with learning pathway steps for these medications? Or do you have any further questions? Yes, I would like to do the learning pathway step. All right, so we're starting with nursing considerations and critical thinking. It goes through and talks about patient assessment, more in depth about the side effects we need to be concerned about as far as nurses, patient education, supportive care, and a professional collaboration and strategies, which is really not there, but might be because of the chemotherapy journey that they need to go through. Step, the learning pathway step, is interactive quizzes. So we'll say, yep, we want to do the quizzes. Here's the quizzes. It goes through different questions that with this application, and I'll just blow through these really fast. If you didn't know the answer, you can always scroll back up and look it up here. That's what that information is there for, as a reference. So you can teach yourself. You don't have to guess. And by some miracle, I guessed and got it right. If I didn't, it would give an explanation similar to what it does when you get it right. So it says this action prevents the conversion, and it goes on to explain that works and why that's correct. All right, so we'll just go through these really fast. Won't read through these. In this case, we got it incorrect. It explains why, if something. And if you needed further clarification, you can just ask questions down here. We'll continue to move on. All right, we got this last one correct, kidney disease, and we've completed the 5 questions for the quiz. And now, really important to see the medication in context of a realistic patient scenario. So that's what we are doing next. It will present a first scenario, and then the final step is the second scenario that is a little bit tougher than the first one typically. So as you can see, it created a patient scenario that's unique, and every time you go through this, it's going to be a little bit different, dramatically different, but it will be in the context of what you're trying to study. In this case, patient scenario is Parker, age 34. You can see her medical history. You can see current condition, how she's feeling, and her symptoms. You can see some lab results here. And then it's asking you, hey, what would you do in this case? She's taking methotrexate, it looks like. In this case, I'm just going to say, I'm not sure, so that you can see this second scenario as well. because we're just introducing the tool. Take as long as you want. In doing this, repeat it an unlimited amount of times, so you get each medication just nailed down. So what you see is, says, hey, that's okay. Let's break it down. And so what it does, RNs knows that you are trying to learn this and nursing perspective. So it talks about patient assessment, patient education, what to monitor as far as labs, administering the medications, like giving Zofran to help with nausea. Supportive care is be considered, and interprofessional collaboration. Look at the second realistic scenario now. In the second patient scenario, we have, again, similar setup. Patient name Michael Thompson, age 58, have medical history here, condition. He came in for a scheduled methotrexate chemotherapy session. Daughter accompanies him. It's trying to give as realistic situation as possible so we can prepare now, so we're ready later when we're actually in that scenario. And then it asks, what do you do? What is your plan for doing this? And you can see answer on this one because we're just introducing it. As you can see, we'll go back up, everything. We did chemotherapy medications. It brought up a summary. We decided to focus on this, although we could have focused on everything. Provides a nice breakdown of both methotrexate and 5-fluorouracil. Then goes into nursing considerations, critical thinking, quiz you, kind of get you thinking. Again, you can scroll up to the top. It's open book, but it's to help you to get that confidence and start mindset into how to learn this medication. Finally, it's important to learn these things in context. So we have a first patient scenario, and then it provides feedback on your answer, on your plan, what you would do. And then finally, it asks a more complex patient scenario, kind of push you a little bit further. Well, I hope you enjoyed Medication Mastery Tool, and wish you happy practicing. Thanks.